Hey guys, this is Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. We've had plenty of questions over the course of time revolving around what is the best sleep position for us to be in every night. I'll kind of give you the traditional layout as far as best position relative to least best position for you to be in, but I'll also kind of add a little caveat when we're done with all this that might help those of you that feel like one particular position doesn't necessarily work best for you. So the worst position that most people would agree on to sleep in is on your stomach. This is mainly because what a mattress typically will do is sag kind of where a lot of your weight is concentrated in your waist. And then what that does is add a little bit of an arch to your low back, so you cause a lot of compression in the joints in the spine. And this can kind of lead to a little bit of achiness and tightness, especially when you wake up first thing in the morning. So I generally encourage people to stay away from this position. The next best position would be on your side. However, there's three different things I want you to focus on if you are a side sleeper. You have to make sure that you have something either between your legs or your knees and hips are stacked properly where this leg isn't rolling forward and kind of putting a torsion on your low back. You have to make sure that with your shoulders, you're stacked just enough, but not too much where you're adding compression in your shoulder joints. So that usually looks like maybe just a little bit of a shoulder kind of roll out on this side rather than something really exaggerated like this. And then last but not least, you have to make sure your pillows are stacked in a way that doesn't tilt your head up this way or make your head sag down this way, but keep your head kind of in this neutral position. So if you're able to pull off all those things, this would be my your next best bet. And then, according to most of the experts, sleeping on your back is generally the best for any type of low back issues and for restful sleep in general. And typically, if you want to add even more comfort with this, you can put a pillow underneath your knees. Sometimes something even under your low back might help people that are having low back pain. Now, the caveat that I wanted to mention to you guys mainly consists with me thinking that there is no best position for us in general, because I think we're kind of designed to move regularly throughout the night. Just like in everyday life, if we hold a stagnant position for too long a period of time, it can be really bad for our body, bad for our joints, our muscles, our lymphatic system, our cardiovascular system. So I think kind of moving throughout the night, not necessarily tossing or turning, is actually a beneficial thing for us. So for those of you trying to seek out a proper mattress, keep in mind it shouldn't be too firm, shouldn't be too soft, but should kind of generally encourage you to have some motion in your body throughout the night. So hopefully this helps some of you going into the week. This is our tip for Tuesday. I'm Dr. Kyle with Columbia River Chiropractic. Thanks for watching.